everyone. I'm Dr. Rwituja Thomas Grover, a consultant Orbit and Oculoplastic surgeon at Vision Eye Centers in New Delhi. Today we'll be talking about ptosis, or the droopy eyelid, which can occur in one eyelid or both the eyelids. So with respect to ptosis, the work of an oculoplastic surgeon is to sort of correct it using plastic surgery. Now, why do we need to talk about ptosis and why do we need to create awareness? So, ptosis has various causes and it can occur in various age groups, and we basically need to address it in a correct manner. That is, what the surgeon does is ascertains the cause of the ptosis and finds the correct solution for that, be it medical or surgical, and finds the associated issues that may be there along with the ptosis which needs correction. So what are some of the causes of ptosis? So one of the main causes is congenital ptosis, or ptosis that's there since birth. Now, when ptosis is there since birth, we may either see the patient at a very young age if the ptosis is very severe, or we see the patient when they are older if the ptosis is mild and they want to get it corrected later. That is, when the child is just about to enter school going age, or when they're much older. Now, the other causes of ptosis are the acquired causes. That is, they occur later on in life. So one of the causes is because of old age. So old age can cause weakness of the muscle, which keeps the eyelid open, and that can lead to a droopy eyelid. This again can occur in one eyelid or both the eyelids. The other causes include any neuromuscular disorder. So there is an entity called myasthenia, and myasthenia can affect the whole body or it can affect the face and the eyelid muscles. So this would lead to ptosis or droopy eyelids, which are more towards the evening, and they may have double vision and things like that. So this has to be picked up by the ophthalmologist, who would refer to an oculoplastic surgeon. Other causes include nerve paralysis, which can cause again double vision and a droopy eyelid. And also you may get a false kind of ptosis because of any kind of masses or any tumors or any kind of swelling in the upper eyelid, which can make the eyelid heavy and weigh it down, causing a droopy eyelid. So this has to be investigated by the surgeon. So with respect to the symptoms of ptosis, one would be the obvious one, that it is visible that there is a ptosis, that you have a droopy eyelid. You may have difficulty in seeing if the eyelid is covering the eye, that is the visual axis. And sometimes you may be raising your eyebrows a lot, which could cause very prominent lines in this area because you're trying to raise your eyelid by raising your brows. So ptosis can also be confused sometimes with what we call brow ptosis, that is drooping of this part of the eye. So when the eyebrow droops, it can cause a false sense of ptosis because of the extra skin, etc., which comes on the upper eyelid. So how does one diagnose the ptosis? So when you visit your oculoplastic surgeon, first of all, if you're taking a child who has ptosis, so the surgeon would basically check the vision of the child, make sure that the ptosis is not occluding the visual axis, causing decreased vision, and of course check the kind of muscle quality that the child has. So if there is a prominent eyelid fold or not, and if the muscle is functioning well or not, because that would decide what type of surgery has to be done. With respect to an adult, based on the causes that were mentioned, we need to check if it is a simple senile ptosis, that is the ptosis which develops with age because of weakening of the muscle, or is it because of neuromuscular causes, like in ocular myasthenia, wherein certain tests have to be done in the clinic to decide if it is a neuromuscular problem. If it is such a problem, the surgeon would refer to a neurologist who would then start treatment, that is medications, and that would help the ptosis improve. Suppose there is a nerve-related paralysis which causes a droopy eyelid. So once that is diagnosed, again you would have to see a physician to make sure that other things are controlled in the body. That is, if there is uncontrolled diabetes or uncontrolled blood pressures, and so on and so forth, that the neurologist would then go ahead and treat that, or we would observe for a natural recovery based on how severe it is and the duration. Suppose the surgeon diagnoses something in the eyelid, that is a localized swelling or a localized mass, then that would require it to be excised or removed to correct the ptosis. So in long-standing conditions, when something is weighing down the eyelid, the muscle may also become weak along with that, so that would have to be treated. And whatever mass is excised would have to be sent for a histopathology, that is a pathological examination of that mass. With respect to the safety of surgery, certain tests are done within the clinic by the surgeon to decide whether it is safe to operate you or not once all the medical causes are ruled out. So one is basically the motility of the eye. So is there any squint present along with the ptosis? So if there is some kind of squint which is present, which hasn't been picked up before, the squint would be needed to correct first. That is, if there is an abnormal alignment of the eyes, that would be required to be corrected first prior to doing a ptosis surgery. You also check the closure of the eye. So if the eye is closing completely or not, and if the eyeball is rolling up well at the time of closure. So this would also decide what kind of surgery. Do we do a complete surgery wherein the eyelid is lifted fully, or do we do a conservative surgery to make sure that the eye doesn't dry up after the procedure? With respect to surgery for ptosis, a few things need to be kept in mind. One is that after the surgery, the eye may not close as it did before, especially in the more severe cases of ptosis. So the eye may not close completely at night. You may have some degree of dryness, but usually this improves with time. The other thing is that on looking downwards, after the procedure, there may be some difference. If only one eye is operated, there may be some difference on downward gaze. The other thing is that if the ptosis is present since childhood, usually when it is operated, a stitch is present on the lower lid at the end of surgery to sort of push up the lower lid up and keep the eye closed. That is done for a week so that the eyes don't get dry because of poor closure once the upper eyelid is operated. So these are a few of the things which you need to know. With respect to surgery, there are grossly 3 types of surgery. So in children or in adults, there are 3 types. So the most common type is the one which is done through the eyelid crease. So a cut is made in the eyelid along the area where the fold of your eyelid is. So usually the fold may not be there because of the ptosis, but it is mirrored with the other eye. Through that incision, the muscle which is weak is sort of tightened and cut, the extra part is cut. So that sort of lifts the eyelid up. This is done in cases where the muscle functions well. In case the ptosis is very mild, that is about 1 to 2 millimeters, then a surgery can be done from the inner aspect of the eyelid. So if there is a good fold which is already present, you can operate from the inner aspect of the eyelid based on certain tests which are done in the clinic to make sure that the patient is a good candidate for the surgery which is done from the inner aspect. So there are no stitches on the skin as such. There may be certain stitches on the inner aspect which will be removed after about 10 days. The third kind of procedure is if the ptosis is very severe and if the muscle which lifts the eyelid is weak. In that case, something called a frontalis sling is done. So in this procedure, an artificial material or a material which is obtained from the patient's thigh, that is taken and it is sort of suspended. So the eyelid from the inner aspect, this eyelid is suspended to this muscle, that is the one which raises the eyebrows. So when it is suspended to that muscle, the eye tends to remain open and the eyebrow lifting movement can control the opening of the eyelids. So another procedure is also done wherein this muscle can be anchored to this area, again through an incision in the eyelid, that is called frontalis flap. So these are grossly the three procedures which can be done. One is for mild ptosis, one is for a moderate ptosis with a good function of the muscle, and severe ptosis with a poor function of the muscle, wherein the eyelid is almost completely down and you cannot raise it up at all by looking upwards. So these are basically the three types. What one needs to understand whenever ptosis surgery is being done is that you may or may not get a completely symmetric result at the first time. So there may be around 0.5 mm, it can be a little bit over or under corrected, but that is fine. So that is what we aim towards. But if there is a 1 or 2 mm over or under correction, that would have to be looked at or revised after a week or after a month based on the surgeon's comfort. So this surgery is basically something where we are trying to match the other eye, but the other eye, it cannot exactly match each time. So you have to give some time for the surgeon to adjust or for the swelling to reduce and then see the final result. So that's all about ptosis. And whenever we talk about the surgical aspect or what procedure is best, that decision is best taken by the surgeon who is operating. So we can move on to any questions. Yeah. So someone has written that he has ptosis in his right eye and he is self-conscious about it. So can he rectify it with eye exercises? Okay. So if there is complete ptosis, as in the eyelid has sort of drooped down completely, or even if it is moderate or mild ptosis, if it actually is a drooping and it is not a temporary swelling, then it is unlikely that it will get corrected with eye exercises. So in this kind of situation, it's best to show it to an oculoplastic surgeon so that they can diagnose the cause, first of all, why the ptosis is present, and if it is something that is a mechanical thing, it is unlikely that exercises or any of that kind of non-medical treatment would help. But if it is something medical, then there are medications also which the surgeon might prescribe to help you correct the ptosis. Another question: is ptosis a serious problem if left untreated? So with respect to children having severe ptosis, that is at a young age, if the eyelid completely covers the visual axis, then yes, it's a serious problem because the ptosis can sort of prevent the vision from developing. So if the vision doesn't develop properly, that is a serious issue for which the ptosis needs to be corrected. So opening up the visual axis and doing certain exercises, patching and so forth, can improve the vision in an eye which has been deprived of vision because of the droopy eyelid. The other situation is that if it is a neurological cause, So if a person who has a nerve paralysis or something of that sort, along with the causing the ptosis rather, and if they don't show a neurologist or an oculoplastic surgeon, then, and if it is a dangerous cause, then that is also a serious issue, that these things need to be treated soon. So that is when you would have to see a surgeon. It's best to show someone right away. The third question is, I want to correct ptosis. Is the surgery painful? So surgery being painful, one thing is that if it is a young child, that is someone below the age of 15, 16, we would generally do the procedure under general anesthesia. That is, the child or the young adult or teenager would be completely unconscious because of the general anesthesia given by the anesthetist at the time of surgery. So there's no pain or anything felt in that situation. The bit of post-operative discomfort which is there, we do give medications for that. So that is a bearable kind of discomfort, and usually nobody has too much of pain after surgery. Whereas in adults, we operate under local anesthesia. So what we do is we put a small cream around the eyelid area where the injection has to be given. And after that, we inject a local anesthetic there. So the cream sort of numbs the skin a little bit. And then the injection goes in and numbs the complete area where the surgery is being done. So at the time of surgery, it is unlikely that you will have any discomfort or pain. Again, after the procedure, there are medications which are given to sort of ease the discomfort and the mild pain that you would have, and it also addresses the swelling. Somebody has asked, ptosis surgery की recovery में कितना time लगता है? तो time basically पहले हफ्ते में अगर बाहर से हुआ है, स्किन की तरफ से हुआ है, तो स्टिचेस हटा देते हैं एक हफ्ते में. बट जो स्वेलिंग होता है, मतलब स्किन में जो आईलिड में जो सूजन होती है पलक में, वो उसको रिकवर होने में 3 या 4 हफ्ते लग जाते हैं. तो मतलब जो फाइनल रिजल्ट है वो 3 या 4 हफ्ते में आ जाता है. तो रिकवरी में मतलब जो आईलिड खुल जाता है उस वाली रिकवरी में यूजुअली 1 ही हफ्ता लगता है. मतलब जो 80% स्वेलिंग है उसमें कम हो जाता है. बट जो कंप्लीट सूजन कम होता है वो 3 या 4 हफ्ते में कंप्लीट सूजन कम हो जाता है. तो 6 हफ्ता हम ले सकते हैं कि कोई भी इवेंट या कोई भी ऐसे मैरिज फंक्शन या ऐसा कुछ एटलीस्ट 2 महीने का गैप होना चाहिए. Okay, someone has asked, I have ptosis since I was 15 years old. Are the surgery results permanent? Okay, so when you're 15 years old, it means that the ptosis is something which is started later on. So it is an acquired ptosis. So some people can develop this kind of ptosis if they have allergic eye disease and they rub their eyes a lot. So this eye rubbing itself can cause a drooping of the eyelid. Now, the surgery results being permanent. So if it is a very severe ptosis and we have to do something like the frontalis sling or the suspension mechanism which was mentioned, that isn't always permanent. It may require adjustment after a few years. If the surgery is done on both the sides, as in we are using the patient's tissue from the thigh, that is a little more permanent. That lasts a little longer. Whereas the silicone band or the artificial material that we use, that tends to weaken a little bit over time and may require correction in 5 to 10 years. If the surgery is a mild or moderate variety, those results are usually permanent once the surgeon has reached the adequate height, lid height that they are aiming for. So the results are usually permanent in mild and moderate ptosis. Okay. So another question from Rashi. She says, I wear spectacles. Will the ptosis surgery affect vision? Okay, this is a good question because ptosis, when it sort of is over the visual axis, it can sometimes cause a type of glass power which is called astigmatism. So this glass power will sort of change once the ptosis is corrected, that is the eyelid is lifted above the visual axis. After that, this astigmatism or this glass power in one axis, that can sort of change axis or disappear completely. So it doesn't affect the vision as such, it can affect the spectacle power. Whenever ptosis surgery is being done, the eyeball is not touched, it's only the eyelid which is touched. So as such, it doesn't damage the eye in any way or affect vision in that sense, but it can change the glass power. Okay, another question. Will ptosis get worse with age? Ptosis, if it is an age-related issue in that particular person, then yes, it can progressively get worse with age. Usually, children who have ptosis from birth, it usually remains stable. It doesn't really, if it's already bad, then it can't get worse. But even if it is a mild ptosis, usually it doesn't change much with time. But yes, in the elderly, it can get worse with age. Okay. What are the disadvantages of having ptosis surgery? So, like I mentioned, of course, when you get the surgery done, the advantage is that your eye comes to a level which you like. Certain disadvantages that may crop up is that your lid fold might appear slightly different on both the sides. So that droopy appearance would go, but the exact fold may not be in the same area, but that usually is not an issue for most patients. The other thing, like I mentioned, is that when you look down, there may be a slight amount of difference in both the eyelids when you look down. So usually patients learn to not look down like this and they tend to turn their head to look down. So when you turn your entire head to look down, then that difference is no longer apparent. The other disadvantage would be the dryness which sort of develops, which is more severe in the first week, but thereafter for about 2-3 months lubricating lubricating eye drops are used, and that usually resolves on its own. So that's a disadvantage which is treated. Can you tell us who is a good candidate for eyelid surgery, or who is not a good candidate for eyelid surgery? So the tests which we do, again, like I mentioned, that to see whether surgery is safe or not. So somebody who has a very severe kind of squint, wherein the eyeball doesn't rotate upwards completely, or it doesn't rotate upwards at all. If that can be corrected by squint surgery, well and good. But if it cannot, then that person is not a good candidate for eyelid surgery, because the eyes can remain open and the black part of the eye can get exposed, and that would cause severe dryness. So that would cause a bit of whitening of the black part of the eye, etc., which is not ideal. So we would avoid surgery in such patients. Or if someone who's been operated earlier, and if their eyelid doesn't close completely, then that would also not be a great candidate. But there are ways in which we can conservatively operate the ptosis. So my final message for all of you is that if you know somebody, or if you have ptosis, or if you develop ptosis, it's best to come in and show your oculoplastic surgeon once, so that number one, you know the cause of the ptosis. Number two, you know what is the best possible treatment. And number 3, you can go ahead with the best treatment for your eyelids. So thank you everyone for your patient listening. And for any further queries, you can always come to our center for a checkup for your ptosis at Vision Eye Centers in Siri Fort Road or in West Patel.